नमस्ते आदरणीय व्यक्तित्वहरू आज चाहिँ म नेपाल हेल्थ प्रोफेसनल काउन्सिल एक्ट 2053 यहाँहरु समक्ष वाचन गर्न गइरहेको छु। यो चाहिँ अंग्रेजीमा रहेको छ। डेट अफ अथेन्टिकेसन भनेको 2053 11/3 February 14 1997 AD Act number 30 of the year 2053 1997 AD an act made to make a provision regarding health professional council preamble, whereas it is expanded to establish a health professional council to make more effective the health service in Nepal, to mobilize the service of health professional except the qualified doctor and nurses to be registered with the medical council in a managed and scientific manner, and make provision on the registration of their name according to their qualifications. Be it enacted by the Parliament in the 25th year of reign of His Majesty King Virendra Bir Vikram Sahadev. Short title and commencement. This act may be called as the Nepal Health Professional Council Act 2053 1997. It shall come into force in such a place and on such a date as the Government of Nepal may by a notification in the Nepal Gazette appoint. Definition. Unless the subject or the context otherwise require, in this act, council means the Nepal Health Professional Council established pursuant to section 3. Chairperson means the chairperson of the council. Member means the member of the council, and this term also includes the chairperson. Health professional means the medical treatment, diagnosis and prevention of disease of sick people or any act pertaining to health profession. Health professional means a person who has obtained the prescribed minimum qualification and is involved in health profession. Register. Register means the name register maintained for the registration of the name of health professional pursuant to this act. Registered health professional means a health professional whose name is registered in the register. Committee means the committee formed pursuant to section 12. Registrar means the registrar of the council appointed pursuant to the section 13. Prescribed is or is prescribed means prescribed or is prescribed in the rule by or by law framed under this act. Establishment of council. A health professional council is hereby established for the operation of health service in a systematic manner and registration of the name of the health professional according to the qualification. Formation of council. The council established pursuant to section 3 shall consist of the member as follow. A person nominated by the Government of Nepal from amongst the person who, having obtained at least bachelor degree in a subject related with health profession, have been involved in the health service for at least 5 years, is a chairperson. B. Chairperson of Nepal Health Technical Association or a representative designated by him or her member. C. Chairperson of Nepal Pharmaceuticals Association or a representative designed by him or her member. Chairperson of Nepal Radiological Society or representative designated by him or her member. 3. Registered health professional nominated by the Government of Nepal from the Pathology, Physiotherapy and Public Health on recommendation of the Nepal Health Member Technical Association. 4 health professionals elected by the registered health professionals from amongst themselves as a member prescribed. G. Dean of the Institute of Medical Sciences or representative designated by him or her member as representative Nepal Medical Council member. 2. The Government of Nepal may make alteration in the member of the council in consultation with the council and by a notification published in Nepal Gazette. If the council consider necessary, it may invite any native or foreign specialist in medical profession to attend as an observer in its meeting. 4. Pending the formation of council, the government of Nepal may form a committee covering the area of referred section 4 for the performance of the function required to be performed by the council. The term of the committee so formed shall be 1 year in maximum. Council to be corporated body. The council shall be an autonomous body, corporate with perpetual succession. The council shall have a separate seal of its own for all of its activities. The council may, like an individual, acquire, use, sell and dispose of or otherwise manage any movable and immovable property. The council may, like an individual, sue by its name and be also sued by same name. Term of members. The term of office of the nominated or elected member of the council shall be 3 years. The member whose term of office has expired may be eligible to be renominated or elected. 2. If the office of any member fall vacant prior to the expiration of the term of office, another member shall be nominated or elected for the remainder of the term. Disqualification for member. Any of the following positions shall not be eligible to be nominated or elected to or hold the office of the member of the council who is not a citizen of Nepal, whose name has been deleted from the register, whose has been convicted by the court of criminal offence involving moral turpitude and serve punishment, or who is of unsound mind. Cessation of membership. The membership of the council shall cease to exist in the following circumstances. 1. If the member becomes disqualified under section 7, if a resignation tender from the office of member is accepted, if the member dies, or if the member, without giving a notice along with reason to the council, absent himself or herself from 3 consecutive meetings of the council. Function, duty and power of the council. The function, duty and power of the council shall be as follow. 1. To make necessary policy for smoothly operating the health professional related activities. To determine the curricula, term of admission and policy on examination system of educational institution imparting teaching and learning on health profession, and evaluate and review the related matter. To determine the qualification of health professional and to provide for the registration of the name of health professional having required qualification. Meeting and decision council. The council shall meet as prescribed by the chairperson. The council shall normally hold its meeting 3 times a year, and chairperson may, if he consider necessary, call meeting more time. The meeting of the council shall be presided over by the chairperson, and in the absence of the chairperson, it shall be presided over by the person selected by the member present at the meeting from amongst themselves. The presence of 50% member of the total number of members of the council shall be deemed to constitute a quorum for a meeting of the council. A majority of opinion shall prevail at the meeting of the council. In the event of a tie, the person presiding over the meeting may exercise the casting vote. The decision of the council shall be authoritative by the registrar. The allowance and other facility received by the member for attending the meeting shall be as prescribed. Other procedure relating to the meeting of the council shall be as determined by the council itself. Delegation of power. The council may or as per necessity delegate its power to the chairperson, any member or any committee of the member is prescribed committee. The council may, for the implementation of its decision from various thematic committee, is prescribed. The provision, function, duty and power and other procedure relating to meeting of the committee formed pursuant to subsection shall be specifically by the council. Registrar. The government of Nepal may appoint any person involved in the health profession as a registrar to carry out the administrative business of the council. The registrar shall act as a secretary of the council. The term and condition of service and facility of the registrar shall be prescribed. The government of Nepal may designate any other employee or officer level of a council to perform the function of registrar in the event of absence of the registrar. Function, duty and power of registrar. The function, duty and power of registrar shall be as follow: to implement or cause to be implemented the decision of the council, to prepare the agenda to be submitted to the meeting of the council. The other function, duty, power of the registrar shall be as prescribed. 15. Employee of council. The council may appoint the required employee. The employee appointed pursuant to subsection shall be under supervision and control of the registrar. The term and condition of service and facility of the employee of the council shall be as prescribed. 16. Application for registration of name in register. A health professional who has possesses the minimum qualification is prescribed and intend to carry on the health profession has to make an application is prescribed to the council for getting his or name registered in the register, subject to this act and the rule framed hereunder. A health professional who is carrying on the health profession at the time of commencement of this act has to make an application under subsection for the registration of his or name within 6 months after the date of commencement of this act. The health professional who make an application pursuant to subsection 1 or 2 for the registration of his or name has to attach the certificate relating to his or qualification, recommendation letter, degree and the fee is prescribed with the application. 17. Examination of application. The registrar shall make necessary inquiry into the application made pursuant to subsection 16 and make a submission to the concerned thematic committee for the registration of name in the register. The concerned thematic committee shall inquire into the application made pursuant to the subsection 1 as to whether the qualification certified and the degree are recognized one or not, and whether the application meets the requirement, and submit a report to the council within 15 days. The council shall, based on the report submitted by the committee pursuant to section 2, make decision to or not to register the name of the applicant in register. Where the council make decision to enter the name of the applicant in the register pursuant to subsection, the registrar shall enter the name of such applicant in the register and provide the applicant with the registration certificate in a prescribed format. Where the council decide not to register the name of the applicant, the registrar shall give information thereof to the applicant. 18. Detection of name from registrar and re-registration. If any of the following circumstances, the council may issue an order to delete the name of the registered health professional from the register where he has been punished by the court in the criminal offence involving moral turpitude. B. Where 2/3 majority of the council adopt a resolution that he has not observed the prescribed professional code of conduct, or where he is unable to carry on profession because of insanity or physical condition. 2. Where the nursing profession whose name has been deleted from the register pursuant to the subsection, showing a reasonable reason, make an applicant for re-registration of his or her name, and the council deem it reasonable for the re-registration of his or her name, the council may give an order to register his or her name. In case where an order is received pursuant to the subsection, the registrar shall re-register the name of such nursing professional in the register and issue the certificate by collecting the fees is prescribed. Revocation of certificate. Where the council get information that the name of any person has been entered in the register by fraud or mistake, and this matter is held to be true following inquiry into the matter, the council may seize and revoke the registration certificate of such person. 20. Prohibition on carrying on health professional. After 1 year of commencement of this act, no person other than a registered health professional shall be entitled to carry on the health profession directly or indirectly. 21. Recognition to educational qualification. The government of Nepal may, on recommendation of the council, recognize any educational qualification certificate or other degree in health professional. The educational qualification certificate or degree recognized by the government of Nepal shall be published in Nepal Gazette. Detail to be submitted. The council may from time to time require any educational institution granting the educational qualification certificate or other degree recognized pursuant to section 21 to submit detail on the curriculum and the term of admission prescribed by such institution for such a certificate or degree. For the evaluation thereof, and it shall be the duty of such institution to provide the detail. 23. Inspection of examination. The council may appoint and depute inspector for the inspection of examination to be given by the concerned educational institute for the certificate of educational qualification or other degree recognized pursuant to section 20. The inspector so appointed shall submit a report to the council setting out such detail on examination inspected by them as may be prescribed by the council, provided that the inspector shall not make any kind of intervention with such examination. Removal of recognition. If upon considering the detail received pursuant to section 22 and the report received pursuant to section 23, the council thinks that the curriculum, term of admission and inspection and operation procedure fixed by the educational institution recognized pursuant to section 26 and 21 are not appropriate and adequate, the council shall submit its report thereon to the government of Nepal. On receipt of the report, the council pursuant to subsection 1, the government of Nepal may, if it thinks necessary, seek explanation from the concerned educational institution having considered explanation, if any, received and holding further inquiry if so required, and based on such inquiry among others, the government of Nepal may cancel recognition of the educational qualification, certificate or other degree in health professional conferred by such educational institution after a certain date by publishing a notification in the Nepal Gazette. Fund of Council. The council shall have a separate fund of its own. The fund of council shall consist of the following amounts: A. Amount received from the government of Nepal. B. Amount obtained as the fee for the registration of name of the health professional, and C. Amount received from any other sources. The operation of fund of the council shall be as prescribed. Account and audit. The account of the income and expenditure of the council shall be maintained as prescribed. The audit of the council shall be performed as prescribed. The government of Nepal may, if it so desire, inspect and cause to be inspected the account of the fund of the council at any time. Dissolution of council. If the government of Nepal think that the council has failed to exercise the power conferred to it pursuant to this act or the rule formed under this act, or has abused power or used excessive power or failed to perform its duty pursuant to this act and rule framed under this act, it may dissolve the council. After the dissolution of the council pursuant to subsection 1, the government of Nepal shall take custody of the fund and other assets of the council, and pending the formation of another council, it may itself perform all such power as required to be performed by the council pursuant to this act and the rule, or caused to be exercised such function by a committee formed by it. The government of Nepal shall form a new council pursuant to the section 3, generally within 3 months after the dissolution of the council pursuant to subsection 1. 4. The government of Nepal shall hand over the fund and asset held by it in its custody pursuant to subsection 2 a new council after the formation of such council. Punishment. A person who carries on the health profession in contravention of section 20 shall be punished as prescribed. A person who commit any act in violation of this act or regulation framed under this act other than the offence mentioned in subsection shall be punished as prescribed. 29. Authority to investigate and file cases. The authority or body to investigate and file cases on offence referred in section 20 and the procedure pertaining thereto shall be as specified by the Government of Nepal by a notification in Nepal Gazette. Government to be Government of Nepal shall be the plaintiff in a case to be investigated and tried pursuant to section 29. 31. Appeal. A person who is not satisfied with the decision or order made by the Council under this Act may make an appeal to Court of Appeal within 35 days after the date of receipt of information of such decision or order. 32. Power to frame rule. The Government of Nepal, with the advice of the Council, may frame necessary rule to implement the objective of the Act. 33. Power to frame by rules. The Council may, with the approval of the Government of Nepal, may frame by laws for the operation of this day-to-day business, frame necessary rule to implement the objective of this Act. Thank you so much. र केही कमेन्टहरु भयो भने चाहिँ कमेन्ट बक्समा चाहिँ राखिदिनु होला. थ्यांक यू सो मच.